and we do appreciate you being here today. And if you don't mind, so we know who we're working with, please drop your name and your organization in the chat at your earliest convenience.
And we actually have a fun icebreaker since we have a smaller group today. If we want to go around and do some quick introductions, I think we see a lot of the same faces today, but if you'd like to just give us your name, your organization, and then our icebreaker for the month, how can the Health Equity Work Group support you this month?
I'll go ahead. Sean King with Community Engagement and Consultation Group, CECG for short. I think the Health Equity Work Group could possibly support by I'm looking for more health fairs to join to participate in around Prince George's County over the next month or two. So if there's any information about that, any upcoming events, I'd be glad to hear it.
Now, Sean, does your organization do you guys span all different health areas? So like chronic disease, mental health, or do you guys focus in on a specific priority?
No, it's not too focused. We kind of look at health as social determinants of health, whole person health, recognizing that there's so many different factors. So we have a nice collaboration with American Kidney Fund. So we're able to, every couple of months we might have like a webinar for diabetes management, or let's say during the month of February, we did some webinars regarding heart health, high blood pressure, and so on, and diet, and healthy eating, and how to stretch your food on like your money on a budget. So yeah, not too specified, just health in general, really. But we're definitely open to do more health education over the next year or so.
Wonderful. Thanks for that, Sean. Yeah, I know of from our behavioral health advisory group, there are several mental health in-person events going on coming up. Not sure if folks are familiar with the Greatest of All Time. It is a very big mental health fair that is happens on an annual basis over at Bowie State University. And so this year, I believe it is scheduled for May 10th. So that's usually a big event. The health department's involved, our local behavioral health authority, several of our providers, nonprofit partners, and then spanning some other health areas. I know Temi, coming from Luminous, they just had a community baby shower celebrating 50 years of serving the community. So certainly hope that went well. But yeah, we will certainly keep you up to date if there are any community events that we can share.
Thank you. And I'll add very quickly, I forgot to mention, we do have, I want to say 5 or 6 different staff members here who are certified for youth mental health first aid. So we're looking to help the youth population out for sure regarding mental health.
Awesome. All righty. Who else would like to introduce, and how can the Health Equity Work Group support you this month?
Well, my name is Denise Robinson from Community Engagement, CECG. Sean spoke on behalf of our organization.
Wonderful. Good to see you again, Denise.
It's good to see you all too.
April, anything you guys need from La Clinica that we could support?
Hi, everyone. For right now, I mean, we're just waiting for them to release the DC budget. So for right now, I can't think of anything in particular, but definitely pending. And if there's any advocacy actions this group wants to take on, I know we spoke about the sign-on letter. Just keep us in the loop, and we'll see how we can get involved, but nothing specific.
Thank you for the update, and certainly let us know how we can continue to support you.
I know for me, and Christine Stewart, co-chair, for me, I would love to keep conversations going. I mean, this is the Health Equity Work Group. We have a name that is in and of itself a challenge in at least the federal administration's eyes. So I'd love to continue conversations with anybody, with everybody, share resources about how your organization or coalitions that you're part of are still working and operating to advance health equity in your missions, despite the stance of the federal administration against things DEI and equity. So I would love to just continue those conversations and not pretend and make sure that we're supporting each other.
Awesome, awesome. Judy, Amber, anything you all need from Prevention Link? That's our the health department's diabetes prevention program. Anything the health equity work group can do to support you?
Nothing immediately comes to mind, but Taylor has been so helpful to Prevention Link, connecting us with additional partners for DPPs and DSMES programs. I'm not sure how much it's been spoken about or how it might be applicable for the youth you work with, Sean and Denise, but we're still working on our family-based behavioral treatment. It's a family healthy weight program. Not sure if there's a space for collaboration there, but potentially.
Awesome, awesome. And then from our University of Maryland partners, Dr. Cooper, anything you need? I know we've got some representation from the Horowitz Center for Health Literacy. Anything going on in campus that you all need help with?
We would look for, we're looking for some partnerships and proposals and being a key factor in the evaluation model for certain proposals and using that platform, which exists because we still have those particular organizations that are private foundations that are still operating in the space of equity. And I'm looking forward to talking about that in the future. And as I've forgotten her name, I think we talked about juvenile justice. Well, you know, I'm also part of a reentry board, and we can see how different enterprises are intersecting. And so there, you know, at this point, a lot of these grants are looking for a comprehensive approach rather than a single agency approach in addressing those gaps that exist in health equity and looking at underlying reasons that are causing those particular issues that exist within those particular populations and within the community.
Wonderful. Alrighty. Well, thank you so much, everyone. Certainly let us know how we can continue to support you between meetings. We are always here and welcome any ideas that you all have that you would like to address at a future meeting. Christine and Dr. Cooper, I will pass it back over to you.
Christine, did you want me to do this or did you feel comfortable or?
I'll go ahead. Just in general, so today, I think so it was already mentioned that we are going to spend some time talking about the Health Assurers Advocacy letter. Taylor did send it around in advance. We'll talk for those who I think most of you have been on previous meetings, but we'll share a little bit about what that is and have an open discussion. Next steps, who's going to sign on, what we need to do to improve and finalize that. Taylor did just drop it in the chat. And then as usual, do community announcements and adjourn. Was there anything else burning that anybody wanted to share?
I think the next slide, if I can remember carefully, but again, my memory is Before we actually go into the letter, I think it's important that we understand the context of the letter and the advocacy effort. There you can see, and is Sharon here to discuss this, or shall we just try to, okay. As you can see, Health Assure's advocacy effort, and you can see back in the early 2025s, there was some funding there. But as we see moving forward, the funding has significantly dropped. And we all know with the shifting paradigm, although there are certain executive orders, the reality is have individuals who are in great need of timely, accessible services. And if you look a little deeper, you can see that there were budget supplements right around the pandemic. And then following year or so, you can see there was a drop in funding. And with that drop, there was an additional source there, but it still had some funding gaps. And again, addressing those particular services and making them accessible and improving outcomes, then, how do we operate in this particular space with adequate funding? And then you can see as we approach 2025 and forward, the funding is even less. It's decreasing even more so. And you can see that the proposed budget has significantly dropped to $1 million. But again, we're talking, this group is, tasked with bridging gaps. So, and then another important element is to look at in February 2025, which is about 2 months ago or so, we can see that the funding has been expended or depleted. So this is why, as a group, it was decided upon, hey, we need to take on an advocacy role, and we need to make sure that that message, is very much disseminated with appropriate parties so that they can see the value of such programs and the implications of those programs being cut or eliminated.
Yes, and I'll just add really quick from that what Dr. Cooper was just explaining there for folks who may not be familiar with the Health Assures program and what it offers to Prince George's County. So Health Assures is funding to support, we here in Prince George's County, we have 6 medically underserved areas that have a federally qualified health center supporting that specifically underserved area. So you'll see one of our partners on the call today, April and Rodrigo, are actually from one of those FQHCs who support uninsured and underinsured populations. And so the Health Assurance program is a vital resource to being able to provide some reimbursement to those federally qualified health centers who provide primary care and behavioral health services to uninsured populations. It's not, a complete reimbursement. So we see, again, as a significant there's significant cost to those federally qualified health centers to provide this baseline primary care. And as you can see, just from looking at the dates here in the county, our fiscal year starts July 1. And so by February 2025, this year, the funding was already depleted. And it's estimated that within 6 to 8 months, funding has always been depleted. So we haven't seen, any county buy-in, as you can see from 2022 to 2025 across all of those fiscal years. It's always, the health insurance program has always been supported by outside funding. So it was COVID dollars or it was ARPA funding. There hasn't been that significant buy-in for this program that you all acknowledged was very important in our last meeting. And so that kind of brings us to the purpose for this letter that you all identified in the last meeting. Again, identifying here we are in FY26. Again, there is a proposed county budget. It has not been passed. There will still be many opportunities for public comment. And so that's why the work group identified this letter as a next step to be able to get this in front of those council members and to be able to talk about the importance of sustaining and maintaining this program. So that letter that you can all hopefully access there in the chat you'll see that it calls for the maintenance of the Health Assures program as it currently stands at $4.2 million. We know that that will not be enough, being that those dollars are already depleted. They were already depleted within, about 6 or 7 months. But at minimum, calling for the maintenance at 4.2 million versus what is being currently proposed at $1 million. So that hopefully gives some context as to what the work group identified in the last meeting. Is there anything that I am missing in that summary or any questions that folks have? And because I don't want it to be lost, I want to give the hugest shout out in the world to Sean King, who took this on. Between our last meeting and now, he developed this draft, went and did research. Coming from a Montgomery County background, he picked up Prince George's County so fast. Really impressive, and really appreciate him taking this on. So thank you, Sean, for being a very vital asset with the work group and taking this effort, moving it forward.
Thank you for giving me the space. I appreciate working with you all.
Absolutely. And so with that in mind, should we go ahead and open up the letter and see if folks have any comments or any edits that they would like to suggest? And before we do that, actually, I do want to ask for folks on the call who are representing from a federally qualified health center, are you all engaged in any advocacy efforts that the Health Equity Work Group could support?
Hello, this is Rodrigo from La Clínica. We are participating alongside Sharon in a group who is tasked with developing recommendations directly to Council Member Walla Blagay, who is trying to introduce the bill. In terms of how the letters would support those advocacy efforts, I think that would be a conversation that I would like to have Sharon's buy-in and others who are sitting at that table to ensure there's it aligns with what that set, because it's a set of the FQHCs are sitting there. So I would like to ensure that the letter matches what that work group is proposing. That is being tasked by the council member and this work group.
Excellent, excellent. Okay, I can follow up with Sharon after this meeting. And I know we also have some representation from the health department to find out if they have a certain figure in mind or how they are going about advocating. But otherwise, here is the letter as it currently stands. And let me know if folks would like to start at a certain point in the letter and make any edits or suggestions.
I think it's a really strong letter. I put a comment in the chat a moment ago. Something DCAO Ask You used to emphasize, especially during the COVID times and, arguing for more money. Funding health is a life or death issue. And we could fit it somewhere in here once, maybe at the beginning and at the end to, drive it home potentially. Because, it talks about all of the social determinants of health and all of these compounding factors, which are critically important, but people don't realize this could kill people if they don't get this potentially.
And we're going to pay for it one way or another.
Exactly. It's cost effective. We could even add in a line, in about cost effectiveness of funding preventative care. Did we have a line in there? I think we talked about the Huron report at the last meeting, talk about how much money the county will spend not funding people up front.
I'm wondering if it seems appropriate here. What is this? The third paragraph here. We talk a lot about the numbers and the burden that it would put on FQHCs. if we mention.
You muted yourself.
Oh, man, one of those days. Curious if it's best situated in paragraph number 3 here. We talk a lot about numbers and the burden on the federally qualified health centers financially. If we could add that in about the cost of care.
Effectiveness. Yeah, we could say the report done for the Prince George's County, the Huron report, shows that, my God, let me pull up the report and see if we can pull a good stat to fit in that line. Keep it on one page. That'd be great. Or what did I think I pulled something last time? I said based on the average healthcare spend per person in Prince George's County of $7,592 a year, this reduction is associated with a savings of $380 million a year. Let me reply to my comment potentially. And then maybe the last paragraph says dire consequences. We could maybe add in the life or death thing there potentially. Dire consequences, comma, life or death, comma, for our community, including deepening health disparities. Or we could add the cost effectiveness thing and the higher rates of ED usage there. Browser.
I mean, could it be as concise as just like a final sentence saying, to be clear, this is a life or death issue for residents at the end of the day? Or do we need to like weave it in?
Not necessarily. We could put it at the end, but I think it would be most impactful to say it once in the beginning and once at the end. Find a good stat now for money. Make sure I have the best one.
Yeah, I am curious. I see the line that you mentioned here. So talking about the social needs, the SNS scores, is that directly related to access to primary care? Or does it talk about investing in other social needs or social determinants of health?
Let me double check. Let me put the report back in the chat again if anyone else wants to pair through it with me.
Yeah, I'm looking at I mean, even talking, and I don't want to get too far away from the point, but like high avoidable ED visits has always been a problem in this county. And so one of the ways to combat that is to be able to provide alternate options for people to seek care. I'm not sure how to word that, but that's,
I think it might be
Yeah.
broken down by a couple of different things. There's like I'm in the page 46 and it says over the span of 1 year, a $1.2 million investment in non-emergency transportation to diabetes appointments can translate to an estimated 5.4 million in healthcare savings. Just trying to find the best example. We could use any one of those examples, I suppose. Let's see. What does that look like?
Yes, I agree with framing the cost of uncompensated care that will hit the hospitals, because that's going to have to be covered through the state emergency Medicaid money. So I think that's a good
Mhm.
argument to to emphasize that specifically with chronic diseases such as diabetes, managing it in primary care is an investment in that pays off immediately. I would also, if because I know the state, but I don't want to limit it only to chronic diseases and diabetes, because I know it has to be broader than that. But if there is good data, I believe in 2020, I don't know if that's still relevant, but the state did produce a diabetes state plan, which pushes primary care as an intervention that should be sustained. And obviously I know there's jurisdictions between state and county, but I think it's worth, because and I'm not from the US, so pardon if I get this wrong, but the Medicaid program would have to kick in regardless of county because it's state level, right? So it's the state who would have to cover at the end.
But we already know that
Yeah.
state, like Medicaid funding is gonna
Yeah.
get cut. I mean,
Oh, yeah.
essentially it's the right thing to do. I just want to say it's the right thing to do.
Yeah.
But Judy, I see your hand's been raised for a while.
That's okay. That's all right. The other piece is you talk about the impacting the hospitals. What it impacts also is the rates that they charge. You know, they get permission to charge a certain amount every year. They have to go to rate regulations and meetings and get approval from HSCRC to do that. And so that piece will impact the whole state. You know, because they're going to have if they're losing money. And all the hard work that the hospitals have done over many years here to try to reduce. I mean, we are as a state, we've done very well as far as the costs of healthcare going up, and I project that is going to be impacted not just with diabetes, but across the board. And so there and it will impact rates, which will impact how much other insurers are charged besides just Medicaid, but also Medicare and all of it. So it has a huge impact.
So when looking, and I think I totally agree. I think we are all kind of on the same page. If we are a county council member and we're looking at a budget for finite amounts of money, how do we say that, hey, we should invest a little bit more money in health assurers, and essentially they're taking it away from somewhere else? Most likely it's going to be like education or safety as the two biggest county. Two other county, I'm sorry, my head hurts. County budget items. Can we make an argument in any way? I don't know. That it's all related. I mean, and that's how I would think, and maybe that's not the right approach. But if we weren't the people that we are, focused on health, and we had other things in mind, maybe we should also approach that. And I know the council member is like on our side and understands, but there's other people. Saw a hand. Where'd you go?
Yeah, I think the counter argument, I believe, could be in the economic, the loss of productivity, specifically who are the people who are receiving the services here. There's great data that supports that construction, childcare, healthcare workers are the people who are receiving care at FQHCs. So they are predominantly people involved in the care economy, if you want to use that term. And I think the economic impact of people out of care or who will not have access to primary care will have a double impact. One, reduced economic productivity for the county, which is bad. And two, increased healthcare costs. So that's how I believe could be a way to. I'd be curious to hear everyone else's thoughts, but I think that going to your original question, Christine, how to sell this to the county.
I like that. What do others think? Is that if we find some concrete data, is that a line do you think we should include or reference the economic loss? And the increased costs in uncompensated care within emergency departments.
Yeah, there's great data. I believe it was the American Immigration Council who has it by state. I to get county specific data from Prince George, I don't know how to do it, but they do of like where, and not to, because not only immigrants benefit from health insurance, but primarily because they're excluded from other forms of insurance, which has like the economic contributions. But I don't know if that would be like a stretch to connect, because we're doing county specific, but that's a good resource who has very good data.
And what was the name of that resource again, Rodrigo?
It's from I can put it in the link, but it's state specific to Maryland.
Okay.
So, but yeah, could be helpful. I'll put it in the link right now, in the chat. I'm sorry.
Thank you.
Dr. Cooper, you asked if there's data visualizations during testimony. I don't know if I can just share from my experience, but I don't know if anybody has a concrete answer. I know when I was providing testimony, I was only reading a letter. There is access to media and screens. However, I think it's usually the invited, whoever has been invited to present. So not just the general public, if that makes sense.
And I see Sharon has joined us. Sharon, in terms of that Health Assures Task Force, are there any upcoming presentations or updates to the Board of Health or County Council, or during that Health and Human Services meeting on, is it the 28th, is it scheduled for?
Are you talking about the Health, Human Services, and Public Safety Committee meeting?
Yes.
Right now, we're not scheduled, but that doesn't mean that won't happen. Sometimes that happens suddenly and unexpectedly. And I think that the data that I provided to Sean when he was working on this letter is the most up-to-date information that I have, and I'm happy to share that PowerPoint if people think it would be helpful. I don't know, Taylor, you saw it.
Yes, we definitely sprinkled in some information specifically about the numbers of individuals who are uninsured, the number of folks who have been seen. I think in 2023 we pulled that data. And and I'm trying to remember if there was a slide specifically about the economic impact. So proving the case of why investing in preventative care is better off for us.
You know, there was no slide about that because it's very hard to find the information. At least, looking at return on investment and long-term impacts you can find stuff like that at the state level, but it's very hard to find it at the county level. And I haven't found it. And if anybody has that, it would be helpful. And, even if they do it at the Maryland Hospital Association level, it would be for the state, not by necessarily the county. It's just hard data to find.
I'm curious, Sharon, I have to admit I didn't get through the entire recording of the meeting, the task force meeting, the Health Assurance Task Force meeting a few weeks ago in early April. I know there was a presentation. Is it Montgomery Cares who came and presented? And I know you said, there are specific nuances that you wanted to call out, but are there any points from Montgomery Cares or DC that we should mention in this letter?
A lot of times I don't like to make comparisons, partly because the environments are so very different, which is one of the things that I called out in that committee meeting, that it's not 100% comparable. I think one of the most striking things is that Prince George's County has significantly fewer primary care providers per 100,000 residents than do Montgomery County or the district. Both of those jurisdictions have plenty of providers. And in Prince George's County, we don't. And I think that one of the roles that the health centers play is that they're able to recruit from federal pools of providers, like the loan repayment program. There's a nursing corps program. They can use J1 visa. It's easier for them to use J1 visa. Foreign trained physicians who are here in the US and can work at FQHCs if they have a J1 visa. So the FQHCs have proven to have the ability to recruit primary care physicians into a county that is largely medically underserved. Maybe that's probably the best way. I can think about it and give you a better sentence, but that's one of the big differences and one of the big benefits of the FQHCs.
Okay. Yeah, I think I remember you said that a key difference was we have 6 medically underserved areas in Prince George's County versus their 1, and then a difference of what, $1.9 billion in our budgets.
Yeah, the budgetary differences. I mean, there's less money in Prince George's County, and we knew that the budget is smaller. It's 1.58 billion, not million, billion, less than Montgomery County. But the distribution, if you look at the top spending areas, the distribution is quite different. Prince George's County spends more on schools and public safety. And some of this is dictated by the state. Prince George's County also has more Category 1 farms, schools, and higher childhood poverty than Montgomery County does. So they spend more on the schools. Public safety it was like, I think it's 10% more on public safety and 6% less on health and human services, which, it's just the distribution is different. So I don't find comparing them. I find it interesting that I think it's interesting that Montgomery County spends so much more on health and human services. In Prince George's County, the spending is 1.1% of its budget. And in Montgomery County, it's 7 point some percent. So I think that's kind of striking.
And Rodrigo, I saw your hand earlier.
Yeah, I was going to compliment with something that Sharon said, but then I realized it would be sort of falling into that same trap when you're trying to compare jurisdictions, including the state, is tricky. So yeah, I'll retract what I was going to say.
Yeah, I tend to think people in advocacy situations, they don't really respond that well to the comparison. It's more all about them. It's all about the county. And less about comparing it to other places. And there's certainly, bringing out that there's a population that's at high risk, and given all the changes and uncertainty in the environment, in the economic environment, that population is just going to become more and more unstable. And they don't need to be falling into medical debt if we can help it. I mean, medical debt is the other issue I think that comes up, which is that, if people have a resource that they can use, regardless of whether they're uninsured or even, people, there are categories of people who may have catastrophic insurance or other insurance that doesn't cover primary care. They can go to a health center and receive sliding fee care rather than paying full freight at a private provider and avoid medical debt. And all of that gets complicated to explain in a short advocacy letter.
And so to close the loop on this economic component that we're talking about here, what do folks think? Should we, I know Rodrigo's put in the chat here some state level data that we could pull. It sounds like it may be easier to find Maryland level data versus county data. Or is there something specific from the Huron or any other reports that folks may know of that would illustrate the economic burden of not funding health assures? What do folks think about that?
I think we should probably try to include that savings number, that 300 million plus. I think that's kind of encapsulates kind of a lot of what we were just talking about.
Yeah, I mean, it's kind of the pay now or pay significantly more later kind of, understanding that, we need to make sure our costs don't go up significantly later.
So here is the line specifically from the Huron report with that $380 million. I guess what I'm looking at here, I'm wondering if we start to introduce social needs, if that will confuse the audience, if we need to keep it, very much focused more so on that preventative care aspect, or if folks feel that it would read succinctly and still to the point.
I mean, maybe we could add like a parentheses of like 2 factors, etc. But I think a lot of people are probably on board nowadays with like social determinants of health, and they kind of understand the effect that those other factors have on health. But that's just my opinion.
And there's a relationship between funding social needs and health and human services and a decreased need in the public safety investment. We're doing things kind of backwards in a sense.
Yeah, I do think it's probably worth, I mean, I could be wrong, but I think it might be worth mentioning something about, I mean, just Sharon, hearing that 1% versus 7% is pretty
Yeah,
startling.
exactly.
And I'm not saying we have to put that in there, but I think maybe mentioning something about the safety, just detracting a little bit from that, I think it might be worthwhile.
I know it's a slippery slope to compare counties, but we are the only county that is likely going to be more than 1 million people come next census. We are most comparable to Montgomery County in terms of population size, so we should not necessarily copy them. There's nuance, we're different, but maybe make an investment upfront, and then would hopefully decrease our need for public safety potentially.
Yeah, I think the one thing I would be very careful about doing is suggesting that in this letter, I don't think that we need to suggest that other areas be reduced, or that you don't want to be in a position where you appear to be suggesting that they take money away from someplace, particularly because public safety, if you listen to hearings and any of the hearings in the county that talk about public safety, I mean, it's really a hot button issue for a lot of folks. And so I would really keep this very focused on healthcare. I mean, there's enough evidence based on Prince George's County health disparities and outcomes that you can just solely focus on health, and people can then make up their own mind about where the money should come from.
Sharon, you went on mute for that last point you were just mentioning.
I'm sorry, without suggesting a place where they might decrease funding. We want to avoid that. And we don't want to make any we don't want to raise the ire of anybody in other areas either.
Yes.
And forgive my ignorance, because I know we're adding a sentence about from the Huron report on the social needs. Does Health Assures cover some of the health related social needs?
No, it basically covers encounters, but for the FQHCs provide for care coordination, case management, and enabling services in some cases. They don't all do everything, but they often provide for transportation and some other things that people need. They will link people to food banks and all that kind of stuff. So we could say something about care management and enabling services. Rodrigo wanted to say something. He might have.
Just to complement everything that Sharon is saying, I do think, and aside from the wraparound service, enabling services is also the cultural component of providing language access and culturally competent healthcare to a large population. I think going off the state data, I don't know PG level, but like 17% of a county is now foreign born. Half of the state is foreign born. Limited English proficiency rates in the county are, I think, 5 times higher than national averages. I think stuff like that emphasizes the FQHCs not only provide essential health services and enabling services, but they also provide them in a culturally and linguistically competent manner.
Yes, and it's not just Spanish speaking. It's the FQHCs. Many of them have multiple language capabilities.
Absolutely.
So we don't want to single out any one group, but cultural competency is highly desirable.
Yeah, I think mentioning Rodrigo, I think some of those numbers would be great to put in here, just to kind of put it all together in a sense, connect the dots for folks. Like if they hear that, they're going to understand that these people struggle already as it is with a lot of things. So, yeah, I think it would be worthwhile.
Yeah, so I mean, even though health assurance doesn't directly cover those social needs, but we're also
connects
providing money to the health centers that are well equipped to address the needs, the multiple needs of the populations that may not be covered by health insurance.
I think the two numbers was 17% foreign born, right? And then you said 5 times higher LEP population than any other county in the state.
I will have to cross-reference my own sources before I confirm on that one, but yeah, yes, it's I believe there's data pointing that certain zip codes in Prince George's County have 5 times the rate. But let me just do my due diligence and get back.
Right. So what's the consensus here to finish up this paragraph about the economic impact? Are we keeping the Huron stat, or do we want to frame it in the way that Rodrigo had initially suggested with bringing to light the reduced economic productivity and increased healthcare costs, including the uncompensated ED costs, the strain on Maryland Medicaid dollars, hospital funding?
I lean towards the what Rodrigo. This is the last what Rodrigo proposed, but then I also realized in the closing paragraph, it kind of already says that without the reduced economic productivity. That is not something that is in the closing paragraph. So I just wanted to call that to everyone's attention. So I want to preserve what Rodrigo said. But yeah, so I think that may address some of it, the edits that I think you're making now, Taylor.
Yeah, I think we can incorporate both deepening health disparities, slashing economic productivity, leading to higher rates of hospital ED usage and increased healthcare costs due to uncompensated ED costs. Maybe add that second point in that sentence as well. So it'll be a long sentence, but pack a punch.
You said it was ED utilization and
Uncompensated costs. ED costs is what we have in the paragraph above.
So I wouldn't say uncompensated ED costs. If you want to talk about uncompensated costs, I would talk about it in the broader sense, because certainly the higher costs are among those who get hospitalized. I would leave it at just talk about the ED wait times, because that's such a huge issue here anyway. Having the dubious distinction of the longest wait times in the entire country is pretty serious, and I think stands by itself. If you wanted to talk about hospital uncompensated care, once again, then it starts to get a little complicated. But certainly there is a level of uncompensated care. But in Maryland, they build the uncompensated care back into the insurance rates, and so it's not quite
Slam dunk.
Yeah, it's not an apples and apples discussion. It's an apples and something else discussion.
Makes sense.
And don't forget, you're the council members, with the exception of the few who've been working on this task force, their expertise is not healthcare. So, we want to keep the facts simple and uncomplicated and straightforward for them. Always leading back to the impact on the population, on residents, and on the county as a whole.
Do we know if the Maryland Hospital Association is doing or saying anything regarding all of this in general? Has anybody heard?
I haven't heard, but I'm sure that they're saying, I think that everybody is universally focused on what's going to happen with Medicaid cuts at the
Okay.
federal level and any potential changes to the FMAP, which would cause the cost shifting from the federal government to the state. And I think universally that has been the focus.
Okay.
Is this kind of closing the thought as we relate it back to Huron?
Is there a specific year for the Huron report, or does it come out every annual year? Like it's annually, right? No, it's not annually. Okay.
No, that report's from what, 2023?
It's
Okay.
2023. It's sitting right here on my lap. I refer to it a
Physical
lot.
one.
Yeah, I like the way it's worded here. Yeah, I like it.
Yeah, that little sentence ties it together nicely.
Right. And then as it currently stands here, do we want to bring the stat in for specific foreign-born residents, the 17%, or what we're able to confirm with the US Census data?
I think it's like 22. It's in the county, but don't quote me. I would definitely look at that. I put the link into the quick facts, the US Census Bureau quick facts. And I looked at the one for Prince George's County. Ah, you pulled it up. There you go.
So nearly 25%.
I think there's a place, if you go down further, where it is actually says foreign born.
More so than this.
Oh,
this
there it is. Yeah.
Persons. Yeah.
Yep.
Yep. The 20. So nearly 25%.
Yep.
Delete that thread. Okay.
Is there something in that Census Bureau? I'm trying to look through it myself, about LEP, or let me see here. I don't see anything related to that.
And if we don't have that, does anybody from the Horowitz Center know any stats? Languages other than English. Yeah. I mean, the closest I see here is language other than English spoken at home is 30%.
Oh, okay.
How do folks feel if we take this part out? So instead of saying most vulnerable communities, if that's where we highlight, like, the 1 in 4, Prince Georgians who are foreign born, 1 in 4 foreign born Prince Georgians have access to culturally competent primary behavioral and oral health care. Or no, because I don't want to call out specifically.
Yeah,
Yeah.
I
because
think
there's
most
still
vulnerable is
other.
good.
Right. Sorry. Thinking out loud today. Um,
Maybe it's. Are we comfortable where it is?
I want to bring it like take a step back. I don't know. I imagine they should be up to date, right, about their own kind of county. But do we think the county is aware of how the population is changing in Prince George's County? Because if not, I feel like it's worth putting something in here. But if we think that they're pretty aware of the different demographics, maybe not.
That's, I think, I don't know, Sharon,
Is it
has that been,
compelling to them?
because that could be something from, at least from the UDS data from all FQHCs. We do ask language.
Yeah, but you know what? The UDS data is no longer available on the website.
Okay.
It got taken down either because they told them to take down, or as a protective measure. Quite honestly,
I
they
think,
may have
but
just
I
taken it
think there
down
are places
themselves.
we can find the archive data. Give me, if we do want it.
So my feeling about this is not to make health assurance only about foreign-born or the Latino community, to keep it broad. And the county knows it's got changing demographics. Whether they adjust their systems to meet those needs is another story. And how quickly they do that. So I would not necessarily make that be the focal point. I mean, cultural competency is very, very important, and I think they will get that. I I wouldn't go too far with the foreign-born stuff.
Yeah, I respect that because I like she said before, like at the end of the day, it's kind of a life or death issue. So I think just counting that and just focusing on the program, I think you're probably right. And then we don't want to open up a whole other can of worms.
Maybe at the very last, after the last sentence, after the hospital wait times, we could say like funding health assures is a life or death issue, because that also kind of ties in with the ED wait times, quite literally.
You could say something maintaining health assurance is a matter of life or death for some county residents, or something like that. Something that ties it back directly to the people.
Matter of life and death for many Prince Georgians.
Yes.
Maybe I think get rid of issue, I guess, since we kept matter.
Mm-hmm.
do folks want to do one more read through for cohesion? Yes. And I hope, was everyone able to access it in the chat if you want to see it on your own device? Because I realize you guys have all been staring at my screen for some time. I'll reshare.
I have been able to access it. It looks like a couple other folks are on there.
I don't see any grammatical errors or anything like that.
Can I drop in here? So it says an increase in uninsured and unemployed Prince George's County residents.
Should we
Okay.
include that since we have abrupt job loss at the beginning of the paragraph? Or should we just say unemployment compounded by unaffordability, the unaffordability of local housing, stagnant wages?
Longer.
Yeah, because I think we can get rid of one.
Mhm.
Also, I would get rid of the to before to pay out of pocket for health services. I think that is an extra infinitive we don't need if reading correctly.
Mm.
I do that.
Mm. Mm.
Very quickly, the last sentence of the paragraph about the abrupt job loss. Do we need to add something like describing to the council members what wraparound services, like specifically, like you mentioned before, they might connect them to a food pantry or, some other, do we need to mention specifically so that they're aware, or do you think that's
Or
unnecessary?
they might not understand. We could say food, transportation. Those are big ones. Let me. Too many tabs open.
My only concern about that is we don't want to imply that the health centers provide these services, and that's how I'm afraid they would read it.
Could we say referrals to food assistance or, um, I don't know.
Connection, or is it connection?
I
I
honestly
think
didn't
that's
realize
almost
that
tied.
FDHCs were doing that, so I can't add too much here of what exactly they're doing.
I think it's almost implied here because we go from like talking about the social needs here. And so, assuming that folks will be abreast of the social needs of their specific districts, but
Yeah, or we could say addressing social needs such as food insecurity, housing, transportation. But like you said, yeah. Hopefully
Yeah.
they know what's going on, and hopefully they are aware that the Huron report exists. And if they need any clarification, they can open it. And hopefully it sways them.
Honestly, I think some of them are not aware that.
Yeah, I was gonna say I don't know, and I don't know if social. And I was gonna ask a frank question because I think we are an echo chamber. We all know what social needs are, but do people outside of public healthcare, um, do they know what those are? Um, I know most of them have received a report out on the Huron report, but that was several years ago. And so much has happened.
We usually
Also-
call them like the non-medical needs. I don't know if that would
Maybe.
lend itself to then needing to provide some examples. Sorry, Sharon, I think I cut you off there.
No, I'm thinking out loud now too, because I think that the Huron report did not get as much play as it should have, and I don't know that people are aware of it. So I would say like the 2023 Huron report revealed that adequately addressing social needs is associated with the estimated cost savings of 380 million. Investing in health assures. Investing in health assures. Ensures.
Investing in health insurers would facilitate
Facilitate,
that
that's a good word.
savings. That savings of or would
Or
facilitate connection to wraparound services and
would facilitate connection to social support services better than essential support services.
I like that.
And so delete this.
Yeah.
Oh, wait, except for what was the last line for Prince Georgians?
Prince George's County residents.
Yeah.
A section, I would even say facilitate connection to early health, to something about health, preventative
health care and to essential social support services.
Yes. Oh, you're so good.
I'm just so good at talking.
Yes, I think that's perfect.
All right. Multiple minds.
Takes a village.
Mm-hmm. Okay, and then in terms of formatting, do we need to, like, maybe if we could we bump this up, like the date and the title here up to like a header? Yeah.
Yeah, that's what I would do. And so we're all signing it digitally, presumably.
Yes, but that brings me to the next question of how do we sign it?
I was going to bring that up.
Do we have like a footer for the coalition, or are we we're not including the HD logo because this is a separate endeavor?
You're also not going to include the coalition because it is a health department.
We are residents and health advocates.
So we couldn't even sign off as sort of members of the health equity work group.
Could we be members of a health equity work group, a community health equity work group?
It's gonna tie up the letter so much.
Yeah. Or just at the end, like respectfully, a community health equity work group, and then list our names. Maybe, I don't know.
I want to keep it from having to go through our approval process.
True.
So I'm sorry to be a stick in the mud, but yes, I think it would have to come from everyone either signing as as a community resident or from their organizational standpoint, because I know not everyone on the call is going to have the agency to be able to sign off from their organization as well.
How about community health equity ambassadors? Or is that too close?
Or I like what you said Prince George's residents and champions for health equity. After particularly concerning, should we say it's a life or death issue? I'm just want to get that in there, beginning and end. Maybe a semicolon, a life or death issue, or matter of life and death. Or I think we said matter of life and death at the end, so we could say life or death issue at the beginning. Or would we say an issue of life or death? Like
You
issue
just
before
say
life
a
or
matter of life and death. Keep it simple.
I really liked that chart that showed how soon the funds were depleted for this fiscal year. If we are able to show it, I hope that helps. The second paragraph especially. Thank you. I just whipped that up. Okay, so in terms of our next steps,
Oh, that's lovely, that chart.
oh yeah, I pulled the data from the Regional Primary Care Coalition, so I'll send it to you, Sharon.
Oh, please do, because I'm going to use your chart.
Yes,
That's
I
so
probably
good.
should have a citation here from you guys, so.
But yeah, well, I don't
know
know if you want to put the site on it because I do a lot of stuff with the county council, so I could give you personally credit for it though.
You know what? It takes us all. So my graph is your graph. In terms of audience, I know when we originally pitched the letter, we were talking about getting it through the Board of Health. So sending it to the senior advisor, Anya, who's usually active on our calls. But Sharon, I know we talked offline about expanding our audience and being able to get this letter out to as many folks as possible. So noted the county chair, co-chair, of course, still Board of Health, and then that specific task force that's been brought up a few times.
I think it's less important for it to go to the task force and more important for it to go to all of the council members. They have all heard at least one presentation on, and are going to hear another soon from the FQHCs. And because council seats turn over every 2 years, it's really important to keep the information and the idea that their constituents are interested in this and are paying attention in front of them, in each and every one of them. So that would be my recommendation, is just to send it to all the council members.
And when we talk about sending it to council members, is it best sent through their chief of staff or directly to their email or specific? There's a specific portal. Why not both? Okay. And then who would like to be the member to submit
the final letter that is signed by all of us. Sean, I see your hand.
I'll
You want to close the
volunteer.
loop on it?
Yep.
Awesome. All right. So I'll work with you offline, Sean, and we can make a list of all of these email addresses that needs to go through, and then create so in the body of that email, can it just be as simple as the purpose of the letter and that there's a letter attached, or is there a specific information that we should include in that email when we do attach the letter?
I think you kind of have to grab their attention a bit, right? It's probably worth putting
so
in a tidbit.
in a timely manner. And we're going to try to testify about this letter, right?
That was going to be my next question. I'm still waiting to hear back if the Health and Human Services and Public Safety, if that meeting is accessible to the public, or if it would have to be at a budget hearing. I think there's one scheduled May 6th and May 8th. Sharon, do you happen to know when the FQHCs are specifically testifying?
No, generally they don't let the FQs testify as a panel. The testimony is usually done separately, and sometimes there'll be a couple of staff from each of the FQHCs testifying, and they just get slotted in wherever there's room. So there's no set thing. The Health, Human Services, and Safety subcommittee is different, and that gets scheduled, and that usually we have one person representing the entire FQHC group testify on behalf of all the FQHCs. And I am not sure how easy or hard it is to get on their schedule, and it's not Anya who would be doing the scheduling, but she could tell you who is doing it.
Okay. I did reach out to her, and we're working on solidifying dates behind the scenes. So what I can do is I will take down the contact information of everyone who's on today's call. I put in the chat a survey link if you are interested in signing the letter as a Prince George's County resident or as a member of an organization interested in supporting. Please complete the survey with your name, contact information, and then if you'll be signing as a community resident. If you're signing on as a resident, we were envisioning having your name and then the district that you live in. And then if you are signing on from an organization, put your name and then the organization's name that you are representing. And what we're going to do is we're going to go through and format this on the final letter. We'll PDF it and then we'll send it to everyone. So it will be very clear where your space will be to sign your name. Now, I know we're almost at time, but I do have a question for you all. We have to get the letter out to you all to sign electronically. What does everyone have access to, like Adobe Sign, Box? What is most accessible for you all to sign specifically? What platform would be helpful?
We could potentially all do like a draw in Word if people don't have Adobe Sign and whatnot, and we could add a field to the form for like a submission of like a signature. So we could copy and paste exit. Although, that's nebulous, but, presumably we trust each other and are only using this for this purpose.
I was going to say, I've done a few of these, and the easiest way I found was to collect people's signatures and how they want to be listed. And it does involve trusting the person that you're sending the signature to, that they're not like signing checks with your signature, doing some other nefarious activity. Because if you send it through Adobe, it's sort of hit or miss whether it keeps going through the process once it gets stuck. The potential for it getting stuck is pretty high.
Yeah, and it would require one person after another to sign
Yeah.
to stay up to date. Okay.
So
Take
in the
longer.
so when I've seen like some folks from Montgomery County do it, they use the Google form as like an agreement, and then they just listed like printed names of all these people and organizations. There wasn't a problem with it, but maybe it is a problem. I don't know.
Like signing an online petition, just digitally signing things. That might be
Yeah,
fine.
just digitally signing your name. Yeah, so I mean, just kind of what you've already put together, Taylor. That's what I was just looking into. Um, not have the actual signatures, because I could see that being problematic for residents who may want to sign individuals, or even like if a CEO of of a larger organization is most likely not going to just, unless it's a very closed group.
Okay, so is that our consensus then? We'll actually just list out names and affiliations without the actual digital signature.
Yeah, I think we could sort them, right? I think we could probably sort them by organizations first, and then a list of just community members after that.
And so that Google form will then stand as your consent to be added to the letter, just so everyone is clear.
Right.
And that's agreeable. Okay. In terms of timeline, can we aim to have everyone acknowledged by, say, Tuesday of next week?
Yeah.
Okay. Because if you have a few minutes now, it's a super short survey, I promise. So if you can go ahead and complete it right now, I put it here in the chat and it will go out with our meeting notes. But I would highly suggest if you can just click on it now and go ahead and get it done, because I know I would end up forgetting about it. So
Yeah,
I'll
well,
send out.
I'll go ahead and since as it looks ready, I'll sign it now. I can start sending it out to other organizations, our partners in Prince George's County.
Okay, so I think we've got our game plan. So again, complete the survey if you are interested in signing and having your name listed on the letter and what details you want included. If you don't include the organization name, or if you're a resident, then we will leave that off. But again, that will stand as your consent to be included in the letter. What we'll do, make sure that you have completed the survey by Tuesday. COB Tuesday, I'm going to go ahead and go in and add everyone's name who has completed the survey, send that over to Sean, and then let's just aim for first thing Wednesday. We'll start getting that out to council members.
You might want to put branching in for the question about if you're signing the letter on behalf of your company, because that says it's required and I'm signing as an individual.
I got you. Let me go over to that.
And then just lastly, if you're able to like actually insert the link for the letter as a link so people can just click it instead of having to like copy and paste it.
Yeah, I tried to do that earlier and it didn't, I guess it didn't refresh. I will, let me edit that now.
That's a lot. And thank you all for your support in doing this. And I would volunteer to testify, but I don't live in Prince George's County, so I just don't feel comfortable doing it yet. Maybe give it a couple years.
Here, I just need change.
All right. Well, thank you. This was productive. I know we're past 4:30, but ask forgiveness, but it was important. Taylor, I know do you want me to roll into community announcements?
Yes, we
have the slides
actually
up.
only have one community announcement. Are any of our partners on the line? Does anyone have any community announcements that they would like to make real quick? Being that you all have graciously given us an hour and 34 minutes. All right, otherwise I'll pass it over to you, Dr. Cooper, to announce this grant opportunity.
Yes. What I would like to share with folks is there's the Robert Wood Johnson. It's called Systems for Action, and it's a community-led research project that looks at tackling and dismantling um, racial discrimination, which creates barriers to services. So basically, they're looking for lead organizations, 501c3, and they're looking for pilot programs or innovative or unconventional programs that could be funded. And part of that component is making sure, because it is research based, that you have the data collection framework in addition to the collaborative framework as well, working with the social services, the medical community, and other community partners in order to address. And the goal is pretty much to make sure that the program is what they call feasible or adaptable in other settings, and that it actually provides institutional knowledge that can contribute to addressing systemic racism. And I'm not going to hold you any longer, but if you are interested in hearing more about it, my email and contact information is here. So please, shoot me an email, and then we can look forward to starting this conversation and seeing how we can create that culture of health by eliminating disparities.
And Dr. Cooper, if you want to put your email in the chat so folks can reach you, and I'll be sure to include that in our meeting notes as well. Any questions for Dr. Cooper or any community announcements anyone would like to share before we hop off for the day?
I have a quick question. Sorry. Is there like an email list, like a specific email where if we send an update or an event or something, it will go out to everybody in the work group, or no?
So if you email it to me, I can get it out to the entire work group. We also have a calendar. So if you have like a specific event coming up, you can put it on our coalition calendar.
Perfect. Okay, I'll probably be, because we have some upcoming events in the next few months, so I'll be in
Okay,
touch.
I'll put our calendar link in the chat.
Thank you.
I had a question for Dr. Cooper. Are you planning on doing a submission? I mean, are you trying to pull together a group to do a submission through or any?
Good question. Yeah, the 501c3 must do the actual proposal. They're the lead agency. And the expectation is for them to have some sort of research model. And once that research model is in place, to be able to collect and analyze that data. And so they're looking for, partnerships, and that particular partnership or collaboration involves, community health workers, the medical community, public health community, social services, getting to the root causes of individuals that may, encounter systemic racism, because we know those particular areas are interconnected. So we know, how do we address those barriers, especially with the shifting paradigm with this administration. And the beauty of this particular proposal is unfortunately, it's due on the 2nd or the 4th of June. But although you're using language specific to systemic racism, they provide technical assistance. So if you're going to speak about this in public, they will provide you with the language and strategies that you can use when talking about this, so it doesn't compromise any future funding or your organization. And just one important thing, it has to be a pilot project or a non-conventional project that meets the criteria for this particular proposal. Are there any questions I can answer for you at this time? Okay, well, thank you so much in advance for your time. Again, if you're interested, please give me a call or email me, and I'm going to put in my phone number, 301. I'm going to check myself. 847. Thank you all again for your consideration and your time.
Yes, and I just grabbed the link where you can view it. directly the request for proposals on our WJF. Alrighty, and I failed to mention earlier, but anyone who is interested, you all now have access to that letter, and it is owned by you all. It belongs to you all. So anyone who is interested in submitting it as an individual without the signatures of everyone, if you want to send it to your specific council member, please do so. Again, we want to get this in front of as many folks as possible. So, please feel free to download it. If you want to put electronic or a wet signature on it, please do so. It is accessible to you all. And that brings us to our closing. Thank you all so very much. We will reconvene as a health equity work group on Thursday, May 15th, but certainly have some action items in between. I will keep you all posted if I hear anything about any of those advocacy opportunities to provide testimony to county council or attend any of those budget hearings. Just waiting to find out from their release schedule what is publicly available or not. I do want to also put on your radar our community care coordination team, one of our other work groups in our coalition. They are hosting an organization called Just Neighbors. They're going to be providing a training to medical personnel and anyone who provides social services on immigrant rights and how to best support immigrant populations here in Prince George's County. So that's a training is scheduled for Thursday, May 22nd. So save the date, and I will invite everyone from the coalition. I think it's going to be a very worthwhile training. They just went through and did the training with Johns Hopkins University. So really excited to bring this here to Prince George's County. And if you know anyone in your social networks who is not a part of the coalition but could benefit from this training, please extend the invite to those individuals as well. Dr. Cooper and Christine, I will let you close us out.
Once again, thank you all for your time and all that you do, and just being a part of what we call change agents in bringing about accurate or accessible healthcare to those most in need in Prince George's County, and being their advocacy and their voice, advocating and being their voice. So thank you for all that you do.
All right.
Yeah,
Well,
great
thank you.
afternoon.
Okay, thank you. Good night.
Have a good night, everyone.
Thank
Bye-bye.
you.
Bye.
Bye-bye.
Enjoy your holiday. Bye-bye.